Clearly, you folks knew about this and the potential health risks and failed to notify the public.
There aren't potential health risks.
Tonight, we uncover the truth about dangerous bacteria in Portland's water. A KOIN 6 investigation continues now. Back in September, 2 water districts actually stopped using Portland water because of those high bacteria levels. Welcome, everyone, to KOIN 6 News at 6. I'm Kelly Day.
I'm Jeff Gianola. Portland continued to supply water to thousands of customers in southwest Portland during this time. And our reporter Carla Castaño broke the story and continues the investigation tonight. She's uncovered proof that dangerous bacteria was in the Portland water supply. Carla?
Well, I've been sifting through all of these documents for weeks, and I found that 3 dangerous bacteria were in the water. According to the CDC, these bacteria have caused deadly outbreaks in hospitals. And the Portland Water Bureau knew the bacteria could cause infections in vulnerable people and still kept it to themselves.
So this is our sample station. First thing I do is open the box. So we let that run for a while. That came back as a bad sample, so it was not good.
Over and over again, right?
Yeah, it's been a problem.
Thousands of pages of documents obtained through a KOIN 6 News public records request show an alarming level of total coliforms. The bacteria levels were so high within Portland's water system in September, they took a reservoir and tank offline and began flushing the system in southwest Portland.
We've never seen anything like this before.
Our investigation found further tests were conducted, finding harmful bacteria near Southwest 27th and Nevada Court, at the Washington Park Reservoir, and at Southeast 50th and Roan. The bacteria was present in 11% of the samples taken. Anytime bacteria is found in more than 5% of the samples, the public warning process is to be triggered. Clearly, you folks knew about this and the potential health risks and failed to notify the public.
There aren't potential health risks.
But there are numerous case studies citing the dangers, and even the Environmental Protection Agency's Office of Water considers all 3 bacteria human pathogens.
You're talking to somebody that doesn't have a background in biology or medicine.
And you're a microbiologist?
My graduate work is in biology with drinking water chemistry and microbiology.
We showed some of the information to Scott Fernandez, who's worked closely with the Portland Water Bureau.
I was a member of the Portland Utility Review Board, and before that the Water Quality Advisory Committee.
Fernandez says he's worried about the bacteria in the water and frustrated the city has not notified the public.
These are opportunistic pathogens that could be very problematic, especially for children and immunocompromised people and older people too. So this is what we have a big concern with.
KOIN 6 News uncovered this email showing Bureau staff knew the contaminants could cause bacterial infection. And while they prepared boil water maps for the entire city, they held back. They're only required to if E. coli is found. They also chose not to warn hospitals and medical centers on their warning list.
There was nothing to alert our customers to.
Not the Enterobacter aeruginosa, the Enterobacter complex, or the Pentora species?
Nope.
The Water Bureau sent the samples to a private lab, not one of the 71 state-accredited laboratories. The Oregon Health Authority wasn't told about the presence of the pathogens either.
I'm sorry, but I don't know what you're referring to.
Commissioner Nick Fish, who oversees the Portland Water Bureau, declined to be interviewed for our story. Meanwhile, the Portland Water Bureau has had so many positive samples for total coliform bacteria, the Oregon Health Authority issued them a violation on October 11th, meaning they are going to have to notify the 17,000 customers in the Southwest Hills who received the potentially contaminated water.
They have until November 10th to do the public notice.
The notice has to say people with severely compromised immune systems, infants, and some elderly may be at increased risk and should seek advice from their healthcare provider. This almost 2 months after they may have been exposed. And now we're told after extensive flushing of the system, the tests within the last few days showed the water is clean. But the Bureau still has not located the source of the September contamination.
Whether or not we're able to pin down, why did we have this total coliform and this amount of total coliform, this repeat sample after sample, I don't know.
This while the Bureau's own emails referred to a similar case in Utah where they found biofilm in the pipes likely caused the bacteria, a problem best handled through pipe maintenance. And the Portland City Auditor has identified the Water Bureau falls short of industry standards and water mains are flushed and replaced infrequently.
The deferred maintenance has been a big problem because that allows for the biofilms to begin to increase in size and harbor these pathogenic microorganisms in the pipe.
A problem that left unchecked could make people sick.
There can be intestinal problems and skin problems and cardiovascular problems.